No one wants to hear the diagnosis of cancer. But perhaps the treatment of cancer is something that we never talk about. And the treatment of cancer in general have surgery, chemotherapy, radiotherapy, psychological therapy, meditation, etc. Today I will refer to something that will improve the side effects and the survival if you take it when you are taking chemotherapy or radiotherapy, or your friend, or your family. Remember, in the box of Immunotec, it says dietary supplement. And this because of regulation that something that is natural is a dietary supplement. But how about if I read you a patent? It's a world patent. You can download it. You will see it in my social network, and says, use of cysteine-rich whey derived protein in patients receiving chemotherapy or radiotherapy to improve patient survival. A dietary supplement. But doctor, this is an antioxidant, and my doctor told me that I do not have to take anything else but what he gave me, or he gives me. Well, this is your cancer, this is your treatment, and this is something that everybody has to understand, that doctors are not God and they miss some things, like I missed this, knowing that this was an application of 2009. I was still working at the University of Illinois. I moved to Medical College of Wisconsin, then to Northwestern, then to be the director of maternal child at County. Yeah, the director of maternal child. Yes, the kid has had leukemias, lymphomas, seminomas. The abstract. A cysteine-rich undernaturate whey-derived protein formulation did not interfere with the tumor cytotoxic effects of chemotherapy or radiation therapy and did not have a negative effect in the clinical outcome. That is, negatively affect survival and increase mortality. Indeed, use of high cysteine undernaturate whey-derived protein in the treatment of cancer patients resulted in an increase in patient survival, probably because this is very helpful not to have this discomfort, burning around the mouth, problems with stomach abscess, problems with your hair, the sensation of that your skin is different. This is a worldwide patent. What is a patent? Well, a patent for metformin has studies and asks for a patent to treat diabetes. The same for amlodipine, or to treat infections, amoxicillin, or ciprofloxacin, or levofloxacin. Then we have to go here, and I ask you, please, go and research description, patient survival. The present intervention relates to the cysteine-rich protein formulation and its use in the treatment of cancer patients to improve patient survival and quality of life. This is your family. Remember, you will say, well, why it mentioned that do not have negative effect? Why in the abstract says clearly do not have negative effect? Because most of oncologists read that outside external antioxidants, not internal antioxidants, the ones who work inside the cell, no. The ones that work outside the cell, vitamin C, perhaps enhance the defense of cancer cells, tumor cells. In this case, the study and the patent says that they do not, Immunocal do not. More, improve survival and tolerance of this chemotherapy or radiotherapy. Now it's your decision, and you will say, well, are you selling Immunocal? I do not care where you buy it, to tell you the truth. If you want, you can put your phone number. If you don't, you can ask for the person that show you this video, but please, do not take chemotherapy or radiotherapy without Immunocal. Still it says dietary supplement. We know what's going on in the industry. We know that. Then why we deny it? Let's go and take care of what we can take care, not the oncologist's work. We have to work in this. We have to read the patent and then not be afraid to help your father, your son, and so on. Remember, kids has leukemia and kids has to take chemotherapy. This is very important for him or her.